parallel to one another. That's another common mistake that a lot of rookies make when they're doing this for the first couple of times. That way you'll have just the slightest glancing contact between the anterior teeth to get some balance. There should be no real hard hammering contact between the anterior teeth when the patient's in their normal centric position. One thing that quite often gives rookies headaches when they're doing this is the position of their maxillary canines. Notice that the neck of the tooth is more buccal than the incisal edge. It's a little bit more prominent. Notice also that the long axis of the tooth starts perpendicular to the plane of occlusion, but then has a considerable distal slant to the component. Remember that you have to, in your mind's eye, imagine where the roots of these teeth are going. And if you were to, say, feel up against the side of your own face where your own canine tooth is, the tip of the root's right up underneath the base of your nose. So that you have to sort of imagine for yourself where that's going to go on this patient. That's where your knowledge of basic dental anatomy comes into play. You take one more look at these things and we'll jump in and start doing it ourselves. Okay. Let's have a little fun here. Make oral Michelangelos out of you people yet. Put my machine back together. Best to start at the beginning and to start in the front. So what we're going to do first is take the number 31 wax spatula, warm it up, and you may want to just look over my shoulder at this, get an idea of what's going on. We're going to cut a window into the wax. And this is where we're going to position the tooth. Remember that when you contoured the rim in the patient, you did it so that you had the proper support for their upper lip. So that you are going to want to set this first tooth, and all the other ones for that matter, so that the labial surface of the tooth is even with the outer surface of the wax rim. Take our little bite plane here. Make sure that the incisal edge is flat against the plane of occlusion. Look at it from the side and see that I have to go back in a little bit further. That's easy to do at this stage of the game because the wax is soft. And just heat that up a little bit. And we stick it in there again. What's so tough about that? Flat on the plane of occlusion, long axis is perpendicular. Look at it from the side. The labial surface is perpendicular to the plane of occlusion. Now sometimes you're going to find in clinical cases that you haven't got enough room for the tooth. You bump up against the base plate. This is not a big problem. The reason being is that in processing, the trial denture base is discarded. So you can just grind all the way through the thing. The way I would recommend do this is to take the laboratory handpiece and grind all the way through from the inside And this serves a number of purposes. First of all, you don't have to worry about how much of the base plate you've got to take away because you've already taken it out. And secondly, you don't have to worry about embedding little chips of acrylic in the wax, which is incredibly unsightly and patients don't like it at the wax try-in. Sometimes you'll wind up still not having enough room for the tooth, and in a case like that you're going to have to grind a little bit on the tooth. As long as you're using acrylic denture teeth, that doesn't present a problem because the acrylic resin that's in the denture teeth is the same stuff that goes into the denture base, it's just a different color, and it's going to chemically bond when it's processed. And what you would do then is use something like this mounted white stone, clean the excess wax off the back of the tooth, and to spare your fingers and have a little bit better control over the situation, use the heel of the stone to remove whatever structure needs to be taken away. Okay. In any event, there we are with a central sizer in position. Now what we can do to make things easier on ourselves later on is to just flow enough wax around the edges of it to hold it in position. That's where this little wax pencil comes into play one more time. See, I can take that and just add a drop of wax wherever I need it without having to worry about spilling wax from an instrument all over the place. And we're also going to make sure this is luted down nicely from the back. And to save ourselves some headaches later on, we'll do part of original waxing for the lingual surface right now. You're going to have to finish down to the height of the cingulum in any event, so you might as well do that now. Save yourself a headache later on. And what I'm doing here is, now this wax has had a couple of seconds to harden, I'm trimming it back to the neck of the tooth, which is really easy to do. Let's just, for a brief second, take another look at one of these denture teeth. If you can get in fairly close to this. See, right here at this point is the cervix of the tooth, where the clinical crown ends, the anatomical crown ends too, and then the supposed root of the tooth begins. And what you can do is, taking the tip of your roach carver, a little spear, cut through the wax until you feel that, and run the tip of the carver right along that, and it will automatically carve your gingival sulcus for you. These people were out there to make life easy for you. Okay, I know we still got a bunch of teeth to go, so let's get moving. Cut another window in here.